Our bodies are constantly bombarded by microscopic invaders like bacteria and viruses. These microbes are everywhere, and they can enter our bodies through various routes, such as cuts in the skin, inhalation, or ingestion. Once inside, they attempt to colonize, meaning they try to multiply and establish themselves. Our immune system acts as our internal defense force, fighting off these invaders. The first line of defense includes physical barriers like our skin and mucous membranes, which help prevent microbes from entering. If microbes breach these barriers, our immune system launches a more targeted attack. White blood cells, the soldiers of our immune system, identify and destroy harmful microbes. This process often involves inflammation, which can manifest as redness, swelling, and pain. Fever is another common immune response, as higher body temperature can inhibit microbial growth. However, sometimes our immune system needs help. When infections become overwhelming or the invading microbes are particularly aggressive, medical intervention becomes necessary. This is where antimicrobial therapy comes into play. Antimicrobials are a broad class of medications that kill or inhibit the growth of microbes. They are essential tools in modern medicine, helping to treat a wide range of infections. Choosing the right antimicrobial is crucial for effective treatment. Doctors consider several factors when selecting an antimicrobial, including the type of microbe causing the infection. Identifying the culprit, whether bacteria, virus, fungus, or parasite, guides the selection of the most effective drug. The severity of the infection and the patient's overall health also play a role. Drug allergies and potential side effects are important considerations. Doctors assess the patient's medical history and current medications to minimize the risk of adverse reactions. Another factor is antibiotic resistance, a growing concern worldwide. Overuse and misuse of antibiotics have led to the emergence of drug-resistant bacteria, making infections harder to treat. Therefore, doctors carefully consider the necessity of antimicrobial therapy and choose the most appropriate drug for each case. Antibacterial agents, or antibiotics, specifically target bacteria. These drugs work through various mechanisms, disrupting essential bacterial processes to eliminate the infection. Different classes of antibiotics have different modes of action. Penicillins, one of the first discovered antibiotics, interfere with bacterial cell wall synthesis, weakening the bacteria and causing them to burst. Cephalosporins, another important class, work similarly. These antibiotics are effective against a broad range of bacteria. Macrolides, such as erythromycin and azithromycin, inhibit bacterial protein synthesis. By blocking the production of essential proteins, macrolides prevent bacteria from growing and multiplying. Tetracyclines also target bacterial protein synthesis, albeit through a different mechanism. Fluoroquinolones, like ciprofloxacin, inhibit bacterial DNA replication, preventing them from dividing and multiplying. Sulfonamides interfere with the synthesis of folate, a crucial nutrient for bacterial growth. Each class of antibiotics has its own spectrum of activity, targeting different types of bacteria. Section 4. Antiviral agents, targeting viral infections. Viruses, unlike bacteria, are not living organisms and require a host cell to replicate. Antiviral agents work by interfering with different stages of the viral life cycle, inhibiting their ability to infect cells and multiply. Acyclovir, a commonly used antiviral, is effective against herpes simplex virus, or HSV, infections, such as cold sores and genital herpes. It works by interfering with viral DNA replication. Oseltamivir, also known as Tamiflu, is used to treat influenza infections. Antiretroviral drugs are a class of medications used to manage HIV infection. These drugs work by suppressing viral replication, preventing the virus from destroying the immune system. HIV treatment typically involves a combination of different antiretroviral drugs. The emergence of SARS-CoV-2, the virus responsible for the COVID-19 pandemic, has spurred the development of new antiviral drugs. Remdesivir, originally developed for Ebola, has shown some efficacy against COVID-19. Molnupiravir and Paxlovid are oral antiviral pills that can be taken at home to treat mild to moderate COVID-19. Section 5. Pain, an unpleasant but vital sensation. Pain, an unpleasant sensory and emotional experience, serves as a warning system, alerting us to potential harm. It's our body's way of telling us something is wrong and needs attention. While often associated with injury, pain can also arise from various medical conditions. Nociceptive pain, the most common type, occurs when specialized pain receptors, called nociceptors, are activated by noxious stimuli, such as heat, pressure, or chemicals released during tissue damage. This type of pain is usually sharp, throbbing, or aching. Neuropathic pain, on the other hand, results from damage or dysfunction of the nervous system itself. This type of pain is often described as burning, tingling, or shooting. Conditions like diabetes, shingles, and stroke can lead to neuropathic pain. Understanding the different types of pain is crucial for effective pain management. Treating the underlying cause, when possible, is paramount. However, various medications and therapies can help alleviate pain and improve quality of life.